So the fact that the province has allowed this to become such a critical issue, it's, in my opinion, inexcusable. But so the question was just this, right? So we don't have enough health professionals, so what are we going to do? I was shocked to hear that his response was that we are going to accelerate the training.
Tamara Ugolini here with Rebel News to bring you a recent announcement by Ontario's Chief Medical Officer of Health, Dr. Kieran Moore, that he and government partners have plans to essentially fast-track medical training in this province. Now, the announcement hasn't been formally released, but Moore's statement comes as the province announces that they will allow students in grade 11 to begin working toward apprenticeships in an attempt to fast-track workers into these skilled trades. And it appears that the same will happen for healthcare professionals in the near future. Dr. Kieran Moore was part of a panel at the Queen's University of Policy Studies that was tasked with looking at COVID at 1,000 days, where the focus was, and I will read it verbatim, what we didn't know, what we know now, and what we wished we had of known. The expected and unexpected, and policies and principles for the next time. Dr. Moore was asked about healthcare worker fatigue and the burnout that plagues the province of Ontario that has resulted in emergency room closures and negatively affected the quality of Ontario's healthcare system. Listen here to his response.
You'll hear investments from government on multiple fronts on the HHR. Coming up very soon. I do think Queen's is a leader. The Q-ARMS program, Competency by Design program, a potentially shortened residency program, shorten the entry into medical school. There is a goal to decrease the total number of years in the medical school and nursing school, compress it to 3 years if possible or shorter, following competency-based design and working throughout the summers. So there'll be investment in innovation and education to shorten the time frame to get these health professionals out. And the announcements should be very soon.
In light of Dr. Moore alluding to this fast tracking of medical professionals, I'm joined now by Professor of Vaccinology, Virology, and Immunology, Dr. Byron Bridal, who has grave concerns over this short-sighted quick fix that likely isn't a fix at all.
Well, Dr. Bridal, thank you for being on Rebel News once again, and as always. Now, what was your original reaction to Dr. Kieran Moore's announcement that they're essentially going to fast track, and as you put it on your recent Substack, warp speed educational training for medical professionals?
Yeah, so I guess just the point of this application of the term warp speed, that's my personal take on it, but of course it's because we're all familiar with the use of that term as it applied to the COVID-19 shots, and the rollout and their development, the warp speed program that occurred there, basically meaning, accelerating a process, doing something faster. Now, the interesting thing is, it's not like this is new. Medical health professionals have been asking for more personnel, and more support, and they've been indicating that they're overworked for a long time, well before the declared COVID-19 pandemic. So the fact that the province has allowed this to become such a critical issue, it's, in my opinion, inexcusable. But so the question was just this, right? So we don't have enough health professionals, so what are we going to do? I was shocked to hear that his response was that we are going to accelerate the training of medical professionals, get them into these positions faster. That's going to be one of our solutions. So specifically, what he indicated was a faster time to get into their training programs, right? So whether it's, and the two examples he used and that he focused on was nursing school and medical school, right? So to train physicians. And most of his emphasis in terms of examples was on the physicians. So that's what I'll do as well. So let's take the medical program, for example. So he talked about accelerating the time to get into the program. So that means getting into it with less prior training. Right. So, for example, what that means is students would be entering the medical program. There'd be more students entering our medical programs in the province who have not completed their undergraduate bachelor's degree, right, at a university. Probably what will happen is this means students will be able to get into the medical programs. More students will be able to get into the programs after the second or third year of undergraduate studies. But So if you're accelerating that time, what you're doing is you're reducing the amount of education that they have received prior to entering medical school. Then what amazed me is he talked about compressing the medical school. And I was shocked because not only did he say shorten it, the programs by a year, he actually said a year or more. So most of the medical programs in our province are 4-year programs. So he's talking about shortening them to 3 years, maybe even less, right, for a physician. And then on top of that, he was also talking about shortening the residency period. And so people understand residency is the kind of equivalent of an apprenticeship in the trades, right? That's where you actually start doing the hands-on work, right? You start working, you're working with patients as though as though you are running your own practice, right? As a physician, as an independent physician, but you are not independent. You're doing it under the guidance of a senior mentor, right? That is, and to me, that might be the most important part of the training, right? That's where you are really learning to become a physician, and you're learning the trade from somebody senior to yourself who can really give you guidance, making sure that the patients that you're looking after during that residency, right, are being treated properly, that all safety procedures are being followed, right? That they're receiving safe, effective treatment essentially from the learning physician. That you talk about compressing that as well to accelerate. So compressing every component, every phase. So this is my concern overall, Tamara, is this is building upon something that we did in Ontario years ago, where we got rid of the 5th year of high school, right? You can call it grade 13, you can call it the OAC year, right? Ontario Academic Credit Years, but we got rid of that 5th year. So that compressed high school from 5 years to 4 years. I can already tell you, as a professor, associate professor at a university, I feel that was a mistake, because what it means is we have 17-year-olds, we have pre-adults coming in to what used to be an adult learning environment, right? And we all know the difference between a 17-year-old and 18-year-old, 1 year during that adolescent phase of development, is huge in terms of maturity, right? And many other things. So these students that are coming into first year, they're 17 years of age, many of them, they struggle, they find themselves lost. All of a sudden, they have this massive amount of independence, right? They find themselves with massive amount of independence, but they also find themselves with these massive workloads with very strict expectations, right? And strict deadlines that they have to meet, things that they weren't used to in high school. And there's all the lifestyle adjustments, right? New peers and all kinds of peer pressures. And I'll tell you, many of our young undergraduate students struggle. They struggle with mental health issues. They struggle to adjust to the new learning environment. Their marks typically are terrible. It is the most normal pattern that I see with people who apply to come to my lab as graduate students is I see their undergraduate degree shows typically terrible marks in the first year, so in the second year, and then they start getting up to where they need to be if they want to consider things like graduate studies, etc. They struggle mightily. I think it's a mistake. Now, we were told that this was to better match what other countries were doing, their time, the length of their education programs, to get people to jobs earlier. I honestly feel that it's more around money, that it allowed the province to cut 1/5 of the teachers, right, from our high schools. And so the pressure's been placed on the students. Now, in addition to that, some evidence of that is students often want to stay now for what they call grade 12 plus. Many students recognize they're not prepared. They don't feel adequately prepared to start college or university at 17 years of age. And so they're opting for what the 5th year that many of us took historically. And so that's kind of evidence that young people themselves aren't feeling prepared enough. Now we want to take these individuals. So this is the extreme scenario tomorrow. If Dr. Kieran Moore has his way with this upcoming announcement about education, you could have a 17-year-old, right, starting their undergraduate program at a university, 17 years old. Now let's say they can apply to medical school after only 2 years of their undergraduate program. That means that they are now getting into medical school at 19 years of age, right? Starting medical school at 19. And then you want to compress that to 3 years. So we're going to be graduating people with MD degrees at 22 years of age. and then they're going to go out for a shortened residency and then start filling in these gaps that we have in our healthcare system. I'm sorry, that is far too much compression of time. And this is all overlaid on a background of ever increasing information overload, right? The amount of scientific and medical information that is being generated through research right now is astounding, and it keeps piling up. I would argue, especially with what we've seen over the past 3 years, I would argue that many of our physicians are insufficiently trained, that their breadth of knowledge isn't broad enough, and the depth of knowledge certainly isn't deep enough. I would argue, if anything, we need to invest more into their training. They need more time to absorb this information, to try and generate nurses and physicians who are younger, less mature, literally less educated. They say they're going to do this based on competencies. They're not going to compromise the competencies. But then what is that going to do?
Obviously, this is a quick fix, and there are no quick fixes here, because this is a decades old issue that's been largely ignored by all governments that have been elected over the past decades.
They are desperate pleas for help, for more support, right? To have more people on the front lines helping them, so that they were not overworked, or they were not having to work excessive hours. They were not trying to deal with excessive numbers of patients, such that they could not give the proper personal care and attention that they wanted to each individual, right? I heard that. Been hearing this for years. So this is an issue that should have been dealt with years ago. And it comes down to money at the end of the day, right? Where's the money going to come from? Now, this is what frustrates me, is over the past 3 years with the declared COVID-19 pandemic, we've seen that when the government wants to come up with massive amounts of money for things that they really want to push, they can come up with incredible amounts of money, right? So to put in perspective, Tamara, people might not realize for most of the declared COVID-19 pandemic at the peak, when we were implementing all these policies, the masking policies, the vaccine policies and stuff, our federal government was spending $500 million a day on that, right? So we know our governments can come up with the money if they're really passionate about something. And that's what it has to be at the end of the day. We can't have these quick fixes where we provide less education to people and compress their education and maintain the same expectations. And like I said, so not only are we going to be compressing their education, putting pressure on them during their training, such that they come out fatigued, possibly feeling already burnt out, then we're putting them on the front lines with a bunch of people that are burnt out. To take on these excessive workloads. I just don't see this as being a proper fix. Now, so my concern is you need the money to train more people. This is the thing. There's never been a shortage of people applying to get in medical school. They've limited the number of positions, right? So you increase the number of positions, and this is the issue. So for something like this, it can't be a quick fix. It has to be a longer term fix. You can't just in 1 year turn around and bring out all kinds. I don't know. Look, we are looking at recruiting people outside of Ontario, right? We've created a scenario where there is no good solution in the short term. There is no good short term solution, but we can't be short sighted. So all we can do now is try and implement a good long-term fix. And to me, it is not compromising the education. It is not shortening. We need to, if anything, expand the length of time so that the large amount of misinformation, the large amount of information that's out there can be better absorbed by these individuals, right? And they can understand it better. And we increase the enrollment. Right, the government, if they really want to fix this problem, they're going to have to come up with the money to increase the enrollment at all of our medical schools, not compress it. And see, this is the thing. This is, again, what bothers me about this. I see this being high school all over again.
After 3 years of COVID-19 related ineptitude showcased by these very same bureaucrats, should we trust that they have the level of competence to repair decades worth of neglect and systemic mismanagement in our healthcare sector? For Rebel News, I'm Tamara Ugolini. Censoring and muzzling actual experts like Dr. Byron Bridal is what brought society down a disastrous path with the COVID-19 response. If you agree that doctors, scientists, politicians, and all medical researchers and professionals should be able to provide their professional opinions without fear of harassment, slandering, or canceling, then head on over to our petition at stopmedicalsilencing.com and sign it today. You can find out more and sign the petition at stopmedicalsilencing.com.